Have you ever been going about your day, perhaps washing dishes or driving, when suddenly a bizarre, unsettling, or even disturbing thought flashes into your mind? A thought so out of character, so utterly unlike you, that it makes you pause, wonder, and maybe even feel a little bit ashamed? Perhaps it's a sudden urge to swerve into oncoming traffic, or a fleeting image of saying something incredibly inappropriate at a solemn event. If you've experienced this, you are not alone. These are often what we call intrusive thoughts, and today we're going to explore what they truly are, what they aren't, and most importantly, how to understand and manage them so they don't control your peace of mind. The topic of intrusive thoughts has gained a lot of attention recently, especially on social media. And while this increased awareness is valuable, it's also led to some common misunderstandings. Sometimes the term is casually used to describe a quirky impulse or a minor annoyance, which unfortunately can trivialize the very real distress these thoughts cause for many. Our goal today is to provide clarity, debunk myths, and offer a truly empathetic, evidence-informed perspective. Let's begin by defining what intrusive thoughts are at their core. Simply put, they are involuntary, unwanted thoughts, images, or urges that pop into your mind without warning. They often feel completely out of character, surprising you with their content, which can range from mildly odd to deeply disturbing. Crucially, they cause significant distress, anxiety, guilt, or shame, precisely because they clash so profoundly with your true values and intentions. This is a critical point. Having an intrusive thought does not mean you want to act on it, nor does it reflect your true desires or intentions. In fact, the very reason they cause such distress is because they are so contrary to who you are. They are not moral failures. They are not confessions of intent. They are simply thoughts. Think of your mind as a busy highway. All sorts of vehicles pass by. An intrusive thought is just one of those vehicles, often a rather noisy or strange-looking one, but it doesn't mean you have to get in it and drive. Intrusive thoughts can come in many forms and themes. Some common ones include thoughts or urges of harm, either to yourself or others, like the high place phenomenon, where you might momentarily feel an urge to jump from a great fight, even though you have no actual intention to do so. Fears related to contamination, germs, or feeling unclean. Thoughts that violate sexual or moral taboos, clashing deeply with your personal values. A persistent need for things to be just right or symmetrical. Existential doubts, where you might overanalyze the meaning of life or reality. Religious or blasphemous thoughts, causing fear of offending a higher power. Worries about public humiliation or embarrassing yourself. Persistent doubts about your relationships, like questioning a partner's fidelity. And for new parents particularly, distressing fears of harming their infant, a common symptom of perinatal or postpartum OCD. So why do these thoughts occur, and what distinguishes a fleeting, strange thought from something more significant? Nearly everyone experiences intrusive thoughts occasionally. They're a normal part of the human experience, a quirk of a busy, complex brain. For most people, these thoughts are easy to dismiss. They arrive, they're noticed, and then they float away, leaving no lasting impact. However, these thoughts become clinically concerning when they are frequent, intense, repetitive, last longer, and significantly disrupt daily life, causing considerable ongoing distress. The key differentiator isn't just the thought itself, but how a person responds to it. If you find yourself spiraling into anxiety, avoiding situations, constantly seeking reassurance, or performing specific rituals to try and neutralize the thought, that's often when a negative feedback loop takes hold, making the thought stickier and more powerful.
When intrusive thoughts are severe and persistent, they can be symptoms of underlying mental health conditions. The most common and well-known association is with Obsessive-Compulsive Disorder, or OCD. Here, intrusive thoughts are the core obsessions, leading to compulsive behaviors or mental rituals performed to reduce the anxiety caused by these thoughts. But they also appear in other conditions. Post-traumatic stress disorder, PTSD, often involves intrusive thoughts, images, or memories related to a traumatic event. They can be a symptom of various anxiety disorders, particularly if you have a heightened sensitivity to anxiety. Depression can involve negative or self-doubting intrusive thoughts. And as we mentioned, perinatal and postpartum OCD or depression can manifest as highly distressing intrusive thoughts, particularly fears related to the baby. Why do our brains generate these unwanted thoughts? Research suggests that several factors are at play. Our brain chemistry, including neurotransmitters like GABA in the hippocampus, plays a role in inhibiting unwanted thoughts. Psychologically, stress, anxiety, lack of sleep, or mental fatigue can make us more susceptible. It's also a fascinating, if frustrating, paradox. The harder we try to suppress or push away an unwanted thought, the more frequently and intensely it tends to return. It's like being told, don't think of a pink elephant. What's the first thing you think of? A pink elephant. So if you're struggling with intrusive thoughts that are causing significant distress, What can you do? The good news is there are highly effective, evidence-based therapeutic approaches available. Cognitive behavioral therapy, or CBT, helps you reframe your thoughts and develop healthier coping strategies. It teaches you to challenge unhelpful thinking patterns. For those with OCD, exposure and response prevention, or ERP, is considered the gold standard. This therapy involves gradually confronting the fears associated with your intrusive thoughts, without engaging in the compulsive behaviors you normally use to reduce anxiety. It teaches your brain that the thoughts themselves are not dangerous, and that you don't need to perform rituals to be safe. Acceptance and commitment therapy, or ACT, focuses on accepting thoughts and feelings without judgment, allowing them to be present while committing to actions that align with your core values. Mindfulness and acceptance practices are also incredibly helpful. These techniques involve observing your thoughts and feelings as they arise, without getting entangled in them or judging them. You learn to watch them pass by, like clouds in the sky, rather than engaging in a wrestling match with them. In some cases, medication, particularly selective serotonin reuptake inhibitors, SSRIs, may be used in conjunction with therapy to help manage symptoms. It's important to reiterate that your intrusive thoughts do not define you. They are not a sign of moral failing or impending danger. They are simply brain static, a misfiring, or an overactive wanted system. Acknowledging them without judgment, understanding their involuntary nature, and learning not to engage with them are powerful first steps. One of the biggest challenges we face with intrusive thoughts is the fear of stigma. Many people, especially new parents experiencing distressing perinatal intrusive thoughts, suffer in silence, terrified of being judged or mislabeled. This fear is understandable, but it's crucial to know that mental health professionals specializing in these areas are trained to understand and help, not to judge. They know that acting on these thoughts is incredibly rare. If these thoughts are disrupting your life, please reach out for professional help. Organizations like the International OCD Foundation and the Anxiety and Depression Association of America are excellent resources, and there are even specialized virtual care providers making treatment more accessible.
The future of understanding and managing intrusive thoughts is bright, with ongoing research into brain chemistry and continuous improvements in therapeutic approaches. But the most important development is increased public awareness and education, which helps to destigmatize these experiences and encourage timely help seeking. Remember, your mind is powerful, and it sometimes throws out some strange signals, but you are the observer, not the captive of those signals. You have the power to learn how to respond differently, to regain your peace, and to live a life guided by your values, not by unwanted thoughts. If you're struggling, know that help is available, and you absolutely deserve to find relief.